My name is Jessica Yunez, and I am a graduate student in the Masters of Public Health program. I, along with Dr. Monique Ridosh from the Marcella Nyhoff School of Nursing, conducted a literature review on the social determinants of health in COVID-19. The social determinants of health are defined as the conditions and places where people live, learn, work, and play. For centuries, social determinants of health have impacted the quality of life and health of human beings. Socially disadvantaged people are physically, mentally, and socially more vulnerable to infectious disease. This creates health inequality, as well as contributes to an unequal burden of morbidity and mortality. As of today, March 3rd, 2021, there have been about 114 million confirmed cases of COVID-19 and over 2.5 million deaths worldwide, reported to the World Health Organization. Social determinants of health have been identified in literature specifically during the COVID-19 pandemic to affect incidence and mortality rates. The purpose of this literature review was to identify the recent evidence of specific social determinants of health within the context of the pandemic. These are important to consider for prevention of the spread of infectious diseases, specifically COVID-19, and it's vital to long-term success in reducing health disparities, health inequity, morbidity, and mortality. For our search strategy, PubMed was used to search for empirical research. Search terms were COVID-19, coronavirus, 2019 nCoV, SARS or MERS, and social determinants of health. Here we have our inclusion and exclusion criteria. Inclusion criteria that is published in the English language, peer-reviewed and published since 2019. Articles were excluded if they were non-data-based editorials, commentary, or opinion-based. Here we have a photograph depicting the social determinants of health organized into 5 key domains. This is from the CDC. And those 5 key domains are education, access, and quality, healthcare and quality, neighborhood and built environment, social and community context, and economic stability. We'll touch on this again in the results section. For the Prisma flow diagram, you can see that within the initial search, there were 427 records identified. After removing the 5 duplicates that were found, we were left with 422 articles. Those were screened, and of those 422, 366 were excluded, leaving us with 56 full text articles to assess for eligibility. Of those 56, 31 were excluded, and ultimately there was 25 studies included in this narrative synthesis. For our results, we focused on education, employment, income, and mental health consequences. Lower level education was prevalent in communities with incredibly high rates of COVID-19. Lower level education was also found to be associated with higher COVID-19 death rates. In terms of employment, 50% of college students reported that their employment was directly impacted by the pandemic, be that they were furloughed, their hours were reduced, or they were completely let go. In a different study, 42% of participants, if they were fortunate enough to still have employment, still expressed concern about their employment due to the uncertain nature of the pandemic. Incidence rate was positively associated with those who spend greater than an hour to reach their place of work, as well as with the percentage of employed persons aged 18 and older in the city. For income, those with very low median household income had financial difficulties purchasing basic needs like food and medicine. It was also found that both individual and medium household income were significant predictors of COVID-19 incidence. In affluent neighborhoods, affluent neighborhoods were associated with significantly lower case rates of COVID-19, while neighborhood poverty was associated with elevated COVID-19 deaths. In terms of the mental health consequences, 1 in 4 people reported having experienced a strong emotional impact with rising anxiety and depression levels. Around 25% stated that their anxiety would lead to limitations in their daily life, and lack of socialization due to rules like social distancing and isolation. The loss of human connection is likely to lead to depression. In conclusion, across all studies, it was evident that social determinants of health have had a significant influence on the rates of COVID 19 and mortality. The literature confirmed that individuals are not equally at risk for COVID 19. Consistent patterns noted throughout the current literature included access to healthcare, education, crowded housing, poverty, unemployment, being an essential worker, or coming from a diverse racial or ethnic background. Social determinants of health need to be a part of pandemic research priorities because there's a potential to reduce future pandemic morbidity and mortality. Thank you.